Hello, I'm John Butler of Hypnotherapy Training International, and I've been asked to say a few words by people who've been in our course in medical hypnotherapy. And medical hypnotherapy is really putting us in touch with the marvelous healing powers that we often take for granted, but that within us and are healing us all the time, regulating our bodies, repairing things, and they're all controlled by the subconscious areas of the brain. We do not take control of them normally at the intellectual cognitive levels. Now, there are many examples in medicine over the years of spectacular healings, which of course are a very small percentage of the number of people who turn up to doctors, surgeries, and so on. But these people still, the numbers run to the thousands, and they're called spontaneous remissions. And they're just left at that for the most part in medicine. And our goal in medical therapy is how to activate that incredible power to stimulate it to higher levels of effectiveness. And this involves learning to use the power of imagination, motivations and desires, the power of faith, and so on, because these have often been found to trigger the healing responses. Doctors over the years using hypnosis have had many, many successes with this. And it needs more scientific research, of course, but there's enough clinical observations of serious professionals for hypnotherapy to be taken very seriously. And there are now increasingly research efforts being taken into understanding more and more about how the mind affects the body. Hypnotherapy, we do know through studies of the brain that it's affecting many emotional areas. It is affecting the autonomic nervous system as well as the emotional areas of the brain, which in turn affect the hypothalamus and brainstem areas, which are vital for life, which regulate our bodies automatically, so to speak. And of course, those areas, when they're working well, it has profound effects on the cardiovascular functions, the respiratory functions, the hormonal systems, and the immunological systems, our immune system, and other systems as well. And hypnotherapy can be considered really to be a neurological therapy on one level. And there's plenty of evidence for that. It's having powerful neurological effects and really needs to take its place alongside a stem therapy, pharmacological treatment, surgery, and so on for the nervous system. Increasingly, neurologists, people I work with, tell me that as well. They're very convinced its time has come for medicine. Now, of course, hypnosis also helps with healing emotion, traumas. This is the psychological side, dealing with people who've had abuse and very powerfully negative, traumatizing effects in their mind, which has affected their bodies. We can help people with these problems greatly through hypnosis to speed up the psychological healing, to get as much recovery and closure to the past as possible. The neuroplasticity studies now and the epigenetics and other fairly recent discoveries of mind-body interactions, they're all helping us to understand more about how hypnosis does affect the innate healing systems. We know that, of course, there's more out there there's a lot we don't understand, and epigenetics, of course, is affected by many things outside of the mind, as is neuroplasticity. But the mind is a critical factor in healing. With hypnotherapy, we help stimulate those emotional factors with the will to live, the will to heal, and then we go about uncovering the emotions that are inhibiting healing. And that's called advanced analytical hypnotherapy, which, done properly, has great value for maintaining and boosting health in everyday life and for helping people resolve problems that are not simply responding to medicine as we might expect them to do, because there's some block on healing, maybe a lack of self-love, some desire to punish the self or others, or so on, the so-called secondary gains. Now, the study of medical hypnotherapy is a very deep study. It's not covered by just superficial courses, which have a lot of gimmicks, maybe unfounded claims, but hypnotherapy in this field has a long history, really about 200 years, and it's been demonstrated to be of great value in so-called psychosomatic illnesses, which do not respond only to medicines. They're not the long-term strategy for dealing with them. The stress-related illnesses, we can help those as well. Again, in combination with medical treatments for symptoms and for helping to correct imbalances, we can help medicine with the treatment of organic illnesses. Hypnotherapy can powerfully help people cope with those illnesses, the stigmas of them and the many other emotional issues to do with them, the fear and anxiety, and also helping the body respond to the chemical treatments and other treatments. And then we have, as I say, the innate healing mechanism within us, which we can also use in surgery. We've done it many times and demonstrated these abilities for coping with pain, to reduce or eliminate pain, boosting the coping during surgery and recovery, and for, of course, chronic pain, which is a great problem in medicine. So I hope to see you in one of our medical hypnotherapy courses. Our next one is in November 24. We have this course online and in person. And this therapy, this medical hypnotherapy, can help you greatly in your life and help you help others. And I hope you will look at our website, hypnotherapytraininginternational.com, find out more about it, and please get in touch if you want to have questions answered. Thank you very much for listening and watching.